Hi guys, can you hear me? Is anyone there? Just testing. So let's just wait for a few more seconds, why don't we? And see whether we have anyone here and we can start. If there's no one, we should go ahead. Hello, and you are welcome to this first live stream on the Medical Information Channel. Thank you for joining me for this first live stream. I'm Dr. Hadiza Marliyya Suleiman, a consultant burns, plastic, and reconstructive surgeon. And today we are going to talk about the Harmattan season and the health effects on the Harmattan season on the body, and how we can mitigate or prevent some of these harmful effects of the Harmattan season. So let's start with the definition of Harmattan. What is Harmattan? Harmattan is a season that is seen in some areas in the world, not all areas, and it's different from the winter season. Now, where I live here in Nigeria, the region where I stay, which is in the northern part of Nigeria, experiences Harmattan season. Now, the Harmattan season consists of dry winds. Now, these dry winds travel northeast upwards and then across the western part of the Sahara, across, going towards the Gulf of Guinea. And with this wind that is carried upwards, the northeastern region, across the western part of the Sahara, we have dust-laden particles in these winds. These winds have dust-laden particles, and that is what is responsible for the hazy nature of the season. Now, this hazy nature of the season is what is responsible for those cancellation of flights, those missed flights, because of the poor visibility during this Harmattan. And apart from the dust, these dust particles, which are very, very tiny, they range from various sizes, from about 0.5 microns to sometimes about 10 microns in diameter. Because of these dust particles, they cause a lot of havoc in the body. Now, we're going to talk about some of these havocs and how to mitigate them in our bodies. Now, this Harmattan season usually occurs between the months of November all the way through the month of March of the following year. And so this period is characterized by a lot of people wanting to stay indoors because of this dusty nature and all the harmful effects it has on the body. Now, let's start, first of all, with hiding indoors. Yes, hiding indoors if you don't really have to go outside. Sometimes, or should I say, during the Harmattan season, if there is really no specific reason why you need to go outside, either for work or for pleasure, it is sometimes a good idea to just stay indoors. Why do you think I'm saying this? Well, it's quite simple, really. If you stay indoors, it prevents you from being in contact with these dust-laden particles that are outside. If you stay indoors, as long as your windows and your doors are closed, the particles that will be available within the home or where you are indoors are limited. And so the harmful effects of these dust-laden particles are really less. But remember that this is so as long as you've taken certain precautions. What precautions, you may ask? Yes. Have you washed those dusty carpets or rugs? Those fluffy carpets in your parlor? Have you washed those thick curtains in the parlor or in your rooms or in the children's room? They need to be washed. Many of us don't wash our curtains, our carpets periodically. And it is imperative that before this Harmattan season starts, although it has already started because we're in the beginning of November already. In fact, the Harmattan season began sometime about the last week of October, here where I stay in the northern part of Nigeria. You should have washed your carpets, you should have washed your rugs. All those air-conditioned filters should have been washed. Those filters in your fans, in your air cooler fans that have been dust-laden for months throughout the year should have been washed. Okay? So please get on it if you haven't done that already. Now, what else can we do when we're indoors? Yeah, we're indoors, we're comfortable, it's warm. Maybe we have our heaters put on in our parlors, in our rooms. And I just want to mention here that many people don't have heaters in their homes during the Harmattan season. You see heaters a lot probably in the northern hemisphere where they have winter, where it's usually very icy and it's snowy, and they usually need to get their heaters. But many of us here don't have access to the heaters, or don't have the funds to buy the heaters, or just forget to buy the heaters, But it is really important, if it is really cold during this Harmattan season, to have your heaters indoors. Make sure that those kids don't go outdoors to play. Have all their fun and games available indoors. Let them play inside, and as much as possible, limit their playing outdoors. Even if they want to play outdoors, for example, they could play in an indoor, play area where they don't have to be exposed to the harsh reality, the harsh climate. Okay. Now, what else can we do indoors? Yes. Don't you just love those times when you're sitting down in your warm room, in your warm parlor with your heater on, you have your hot beverage by your side, or your warm cup of soup ready for you to devour? Lovely, isn't it? It will warm your system. It will keep you warm. It will keep your body comfortable. And those fluids will keep you hydrated. Yes, one of the important things that the Harmattan season does is, one of the harmful things is that it tends to dehydrate your body. Your water is left without too much fluid in it if you don't top up your fluids. Now, these fluids don't have to be only in the form of water. They can be, as I mentioned before, in the form of soups, in the form of beverages, which are preferably warm, suitable for your body temperature. They can also be fruits and vegetables. So why fruits and vegetables, you may ask? Yes, fruits and vegetables are also high in water content. What sort of fruits? Watermelon, one of the very, very important sources of fluid in our fruits and our vegetables. We have other fruits such as cucumbers, fruits and vegetables such as cucumbers. We have strawberries, we have avocados. Now, all these fruits provide you with adequate amounts of fluid. And so eating them during this Harmattan season will really help you in maintaining that body water, will keep your skin supple, it'll keep it soft, it'll keep it hydrated. Now, what else can we do indoors when we're indoors and it's cold or it's during the dry Harmattan season? I forgot to mention, the Harmattan season consists of not only dust particles, but it also consists of fluctuating temperatures. Sometimes you can have very hot temperatures, you can have very cold temperatures, you can have temperatures in between. So it really just depends on, what is happening at that point in time. This is very unlike the temperatures in the winter season, isn't it? Where you have most most times consistently cold temperatures, sometimes even below zero. The temperatures in the Harmattan period can range from sometimes about 9 degrees centigrade to sometimes even to about as high as 39 degrees centigrade, believe it or not. Yeah. So if it's really, really cold, you may use a hot water bottle or a warm water bottle. Let me not say hot because some people will tend to fill up their hot water bottles with very hot water, which can end up burning them. So please don't use very hot water bottles. You just use hot water bottles. You can put them under your blankets to warm your beddings, your duvets, your quilts, so that when you come to sleep, you'll be warm and comfy. How about humidifiers? Have you heard about humidifiers? Yeah, humidifiers are appliances that many of us use in our homes to help keep the the um, the the air around us moist. We all know that the dry and dusty Harmattan weather tends to dry out the airway. That is our airway, from our nostrils, our noses down, to our bronchi, to our lungs. Usually the airway is very dry during the Harmattan season. So it is important for us to get humidifiers, especially people who are prone to developing allergic respiratory, or should I say allergic airway disorders, especially during the Harmattan season. This Harmattan season is the season where people that are allergic to dust come down with all sorts of complications. We can have, a lot of us have children that have allergies to dust and tend up having an inflamed airway during the Harmattan season. And this results in them having a lot of, upper airway conditions or diseases, which will give them symptoms like coughing, sneezing, an itchy throat, a runny nose, temperatures, which may sometimes lead to us seeking care from the physician, from either the pediatrician, the ear, nose, and throat surgeon, our family physician. I mean, it just depends. So if you have children, or even if you or any members of your family within the home are prone to developing these allergic airway conditions, it is very important for you to get those humidifiers in your homes. These humidifiers work with water and they help to moisten the air in your environment, thus making the airway moist. It helps to flush away those harmful irritants, those harmful substances in your throat will be washed down, and it will reduce your risk of developing those upper airway disorders during the Harmattan season. What else can we do during the Harmattan season when we're indoors, apart from all these other things that we have mentioned? When we're going to have our baths, please do not use cold water. Do not just use tepid water. Use warm water to have your baths. Yeah, because your body will be warm. The constant temperature of your body will be maintained in that warm environment, and you are less prone to come down with, inflammatory or allergic conditions that are associated with the Harmattan season. So yes, put on those heaters, put on those bath heaters, let them become hot or warm, and then you can dilute it to the appropriate temperature, which is tolerable for you, and have those warm baths. Now, what else can we do during the Harmattan season to help us from falling ill, so to speak? Yes, when you've had those warm baths and you're comfortable in your room, will you moisturize your skin? Yes, I will moisturize my skin. But why should I moisturize my skin? I will moisturize my skin because my skin is most likely dehydrated. It's most likely, it most likely needs some moisture, needs some lubrication so that it will not dry out and look flaky and look wrinkly. Okay? What should I use to moisturize my skin? And don't forget, when you come out of your bath, immediately afterwards you come out of your bath, you towel your body with your towel, immediately moisturize that skin with that lubricant. Okay? Don't wait for a while, maybe playing on the phone, don't talk on the phone, don't do something else immediately afterwards, so that that skin doesn't get too dry. Before it gets too dry, moisturize that skin immediately, lubricate that skin with that natural body butter, or that natural body oil. What sorts of moisturizers should I use on my body to lubricate my body? You can use natural body oils. For example, you can use your shea butter oil. You can use your coconut body oil. You could use your jojoba body oil. There's so many of them. You can use your olive oil. You can use all sorts of natural body oils, preferably to moisturize your body. And if you don't have that, you can use your various body butters, your various body creams, your various body moisturizers, and you use it all over your body. There are some areas over the body that are more prone to becoming that are actually thicker. For example, the palms of your hands, the soles of your feet, they're usually thicker. So they usually require a thicker layer of moisturizer. And then there's some exposed parts of your body. Your lips. Your lips are exposed so much to the outside environment. So you need to make sure that your lips are adequately lubricated or adequately moisturized. And so always have your Vaseline with you, your lip balm with you whenever you're going to go out. In your purse, in your bag, have it available so that your skin, your lips, your palms, the soles of your feet will be adequately taken care of. Now, what else can we do apart from what I mentioned before? Lest I forget, another reason why I should take a lot of fruits and vegetables during the Harmattan season is because fruits and vegetables contain a lot of vitamins and minerals. And these vitamins and minerals, especially vitamin C contained in them, helps to serve as a natural immunity booster. We know that vitamin C is a natural immune booster, and it helps to prevent, or should I say, helps to fight off colds and coughs. And so if you take a lot of these natural natural fruits and vegetables, especially those vitamin C containing hydrating fruits and vegetables, you will be boosting your immunity, thus lowering your risk of developing those itchy eyes, those allergic skin conditions, those runny noses, those terrible, brassy, barking coughs that are so scary sometimes when those children have them, those children with allergic skin disorders. I have known some people to even run away from areas that have Harmattan, or make sure that they have holidays in areas where you don't have harsh winters or harsh Harmattans, to avoid all these complications of the Harmattan season. Once it clocks November, they run off with their children, with their family, to areas that are warmer climates, and where they don't have to deal with all these issues that I'm mentioning during the Harmattan period. And I'd like to say that another reason why we don't use very hot water when we bath is that the hot water tends to strip your skin of the natural body oils. So that is why I'm advocating for using warm water when you're having your baths. Yes, what else can we do indoors before we talk about what you do outdoors? Yeah. How about your choice of clothes when you've had your bath? Yeah. You need to still protect your skin after moisturizing it. You've used warm water to have your bath. You've used your moisturizers to lubricate your skin. And now you use warm protective clothing to cover your body. All right. You use natural fiber, natural materials, preferably, to cover your body. You can use your cottons and your silks to cover your body, adequately protect and cover all exposed parts of your body so that you will be comfortable. It will keep your body temperature warm, constant, and thus, will prevent you from coming down with some of the conditions that we're mentioning today. All right. Some fibers like wool may irritate the skin, and this is seen in some people. So if you know that you are allergic to some sorts of fibers, it's better for you to stick to those natural fibers I mentioned before, like the cotton and the silk. What else can you do when you're indoors? Yes, you need to still maintain a high degree of what? Sanitation. You should wash your hands. Wash your hands before every meal, before and after touching objects. Wash your hands frequently. Sanitize them frequently with hand sanitizers if you don't have a nearby source of water. Although, well, if you're indoors, you do have your nearby sink and your running tap to wash your hands. You can wash your hands with soap. You can use liquid hand wash to wash your hands. And if you have unfortunately, or if anyone in the house has unfortunately come down with a cold, a cough, the flu, or they have itchy, runny eyes due to some form of eye conditions, which can be quite common during the Harmattan season. We'll mention them later. Please make sure that you wash your hands frequently so that you don't infect yourself directly, you don't infect others, and you will have an overall lovely Harmattan period. So, have we exhausted all the things that we can do indoors? I think we have. You can take your mild lemon and warm water in the form of a tea. You can take it just plain if it makes you feel more refreshed when you take it, when you're trying to rehydrate. And some of us do some things when we're indoors that we should not do. Please, please don't do them. Some people think that if they do some certain practices, either indoors or outdoors, unfortunately, many people do this indoors, that it may keep them warm. Some people smoke. Some people take alcohol, thinking that that keeps them warm. That will keep them warm during the Harmattan season. But taking alcohol, smoking will only keep you temporarily warm, just temporarily. Because what happens is the vessels over your skin dilate or open up just for a short period while you're doing those things. And after that, they close back or constrict back, and then you're back to square one. You'll still feel the cold. So please, apart from the fact that these practices are not really healthy, they will not permanently keep you warm. And if you just say, oh, fine, I'm going to just keep on taking alcohol, I'm going to keep on smoking because I want to feel warm, then you just be ready for the harmful effects of that smoking or the harmful effects of that alcohol that you're taking. All right? Can we get to outdoors now? I think we can. Yeah, so I have to go outside. Hadiza, I have to go outside. I need to go to work. And at work, unfortunately, I need to stand outside. My work entails mowing people's gardens. My work entails standing outside because I'm a policeman. I need to stand outside during my working period. That is my job description. I'm a soldier. I need to be outside. Okay? Yes, we know that there's times where you can't help being outside during the Harmattan season, either because of work or because of, well, leisure. You can't keep staying indoors for your whole life, or should I say for the whole season during the Harmattan season, can you? No, you can't. So yes, there are times when you need to go outside. So if you need to go outside, you still need to take some precautions, just like how we talked about the various precautions that you're going to take or that you've taken inside your home. You need to also take precautions when you go outside. If you go outside, thank God you've worn those warm, those that warm clothing that we talked about. You've worn your warm clothes, your natural fibers, and now you've protected those exposed parts of your body. And yes, you're ready to face the Harmattan season. Yes. So you've gone out. What else have you done as a protective measure when you're going out? Have you worn your face mask? It could be any form of face mask. It could be a cloth mask. It could be your surgical mask. It could be your N95 mask. It could be your KN95 mask. But just wear a mask. That mask will help to prevent those dust-laden particles that you're going to be inhaling. It's going to lessen the amount of those dust-laden particles that are going to enter into your nostrils and into your mouth. So please, those face masks that we've been using to prevent ourselves and our families from COVID-19 during the pandemic, and even, well, now, yes, you still see people using face masks, although not as during the height of the pandemic. But I noticed that a lot of people, especially at my workplace, are wearing the face masks, not necessarily because of preventing themselves from COVID-19, but also because they have found out that when they wear those masks, it does help to prevent them from dust. And then they tend to fall sick less from respiratory infections. So I think that is something we should all be doing when we go outside. We should wear our face masks. And for those of us that wear glasses, do you know that these glasses are also going to prevent your eyes from those dust-laden particles that are in the air during the Harmattan season? Yeah. If you do not wear medicated glasses, you could wear a pair of sunglasses, protective eyeglasses, to prevent you from those windy days during the Harmattan season. Because these dust particles can end up inflaming your conjunctiva, and you can develop some allergies from these dust particles. These dust particles can also contaminate your eyes, and it will lead to a higher incidence of you developing some eye conditions. So please wear your eyeglasses if you can, when you're going to go outside. All right? What else can we do while we are outside? You've covered your body, you've covered your eyes, you've covered your mouth. Yes. What else can we do? I've mentioned it before. You can carry around your lip balm in your bag, in your handbag, to keep those lips moist and supple so that they will not get cracked. All right? Make sure that if you are a person that has conditions, some disease conditions that are aggravated or that get worse during the Harmattan season, just make sure that even before the Harmattan season or just at the beginning of the Harmattan season. I mean, the Harmattan season has already started, right? Well, so why not just go and see your family physician? If you have a child that has allergic conditions, allergic airway conditions, why not see the ear, nose, and throat physician? Why not see the pediatrician for advice during this Harmattan season? The physician may decide to upgrade their medication, probably change their medication, probably introduce new medications so that they will have fewer or less frequent incidences of having these allergic conditions. Now, some of these conditions that are more prevalent, or should I say more aggravated, or that are aggravated or get worse during the Harmattan season, include conditions like asthma. Asthma is a chronic obstructive airway condition that is seen in both adults and in children. And the Harmattan season has been known to provoke or make worse this asthma. The medication that you take during the Harmattan season may actually need to be taken more frequently. You may need to take more medication, and you need to take more measures. You need to take upon more measures to protect yourself from exposure to these dust-laden particles during the Harmattan. And so always have your inhaler near you. And as I mentioned before, make sure that you see your doctor whenever you fall sick. Don't just self-medicate. You may decide to take a few maybe throat lozenges when you have a sore throat, or maybe take something for that runny nose. But if you feel that your symptoms are getting worse, then the best thing will be for you to visit your physician for advice, plus or minus medication or extra medication. Now, apart from that, have you heard of the condition called sickle cell disease? Maybe you have. Now, sickle cell disease is a condition, which it's a genetic condition, uh, where some people are born with this sickle cell condition. And what happens is that these sickle cells are actually abnormal red blood cells in a person's body that tend to get sickle shaped, like in the form of a sickle. Usually the red blood cells are spherical in shape, but people with sickle cell disease have these sickle shaped blood cells. And these sickle shaped blood cells tend to get even more sickled, should I say, during the Harmattan season if the necessary precautions are not adhered to. If you expose a sickle cell disease patient to extremes of temperatures, they'll fall sick. If you expose them to dust-laden particles, they will easily fall sick. And so this weather is not for them. And so they need to visit their family physician more often if they're not taking the adequate measures to protect themselves. I've mentioned, of course, before, people that have allergies, that are prone to allergic skin conditions, please and please, you need to take your medication as much as possible. What else can we do during these? What should I say? What else can happen to us during this Harmattan season? Some of us, when we get these upper airway conditions and develop colds, catarrh, we tend to have really, really violent coughs that, apart from the fact that we need medical attention, we realize that sometimes some of us are prone to developing nosebleeds because of this forceful coughing, which is called, these nosebleeds are called epistaxis. And these are usually minor nosebleeds, which usually occur due to the breakage of the small blood vessels in our nostrils during aggressive sneezing. If it becomes really, really bad, if the bleeding gets really, really bad, we will need to seek the advice of a healthcare professional. But we must make sure that we don't pick our noses, because sometimes Of course, as we know, during the Harmattan season, our nostrils are usually very dry, and many of us tend to pick our nostrils. That's a very bad habit. It's a poor hygienic habit. Please don't do that. And that can leave some of the blood vessels within our nostrils to become injured. And as I mentioned before, with violent sneezing, violent coughing, that can also predispose us to developing minor nosebleeds during the Harmattan period. And still for the sickle cell disease patients, I didn't mention that, that low oxygen tension can predispose those attacks of those sickle cell disease crisis. So it's advisable to keep our sickle cell disease patients warm. We should let them wear adequately warm layers of clothing. I let them not get hypothermic. That is, let their temperatures not be below the temperatures that are, advocated. And we also know that because the humidity during the Harmattan or the dry season drops by sometimes even by 10 to 15%, you need to make sure that, yes, the moisturizing your skin is regular, your fluids are regular. And mummies, please make sure that all your children are vaccinated against all those common conditions that we see in children during these periods, even adults. There are schedules for immunizations against the flu, against COVID-19, which are more prevalent during the Harmattan season. So I advise all of us to please go and get all these shots. It's better for us, all right? Do you know that there is this condition that is quite common during the Harmattan season that I'm sure many of us have come across or have been exposed to, or know people that have developed, or meningitis? Yes, meningitis. Meningococcal meningitis is more common during this Harmattan season. It's usually more common between November, which is right now, to February, in the areas of the meningitis belt. So there's this area called the meningitis belt, which is located in the sub-Saharan Africa. And it extends from a place from around Senegal in the west to around Ethiopia. And this meningitis belt has specific countries which are more prone to developing meningococcal meningitis. Please do not forget this. So we know that meningococcal meningitis is airborne. It's carried in the dust. And these winds are blowing so hard and so widely during this season. So we need to take adequate protective health measures. Okay? Wash your hands. Cover your nose when you're coughing. Preferably, please wear your face mask at all times. Don't go and infect others with the meningitis virus in your nostrils. Please don't go and infect others. Take adequate measures. Wash your hands frequently. Use your hand sanitizers. Always make sure that you pass across the message to your friends, your family. Make sure that wherever you are, you maintain a high degree of health. Some of us have, unfortunately, allergic skin conditions during the Harmattan season, yes, especially when the skin gets really, really dry. The skin tends to become very, very itchy and irritated and inflamed. And so if you know that you're one of those people that tends to develop itchy skin during the Harmattan season, which is a form of an allergic skin condition which has been diagnosed by your dermatologist or your family physician, then moisturize your skin with something that is bland, preferably your natural body oils. Take your medication if you're on any anti-allergy medicine for the skin or for your eyes or for your airway, and make sure that you take care of yourself adequately. Have you heard of Apollo? Maybe many of us have heard of this condition. It's an eye condition called Apollo, commonly known as Apollo, should I say, but it's actually called acute hemorrhagic conjunctivitis. Now, what is this acute hemorrhagic conjunctivitis, you may ask? Acute hemorrhagic conjunctivitis is a viral infection of the eyes commonly seen during the Harmattan season, which results in you having itchy, runny, inflamed, reddened eyes that are so sensitive to light. And it's such a painful condition and so incapacitating that people that develop acute hemorrhagic conjunctivitis never want to develop it again, or even abhor their enemies getting from getting that eye condition, because it's such a terrible condition. All right. Now, this condition, once you suspect you have it, please visit your physician. Visit your ophthalmologist, visit your family physician, visit your physician to get advice on how to manage this condition. You may be prescribed some anti-allergy medication or some anti-allergy medicine for your eye, and that will help soothe the eye condition and make you more comfortable so that you can carry out your normal everyday activities. What else haven't we talked about so far? Let me see. I think we've mentioned almost everything today, but we forgot to mention something I just saw now. Do you use air conditions during the Harmattan period? Remember that I mentioned that the Harmattan period consists of fluctuating temperatures. It may be very hot it may be very cold in the morning, and then it may become very hot in the afternoon, and then the temperatures might drop again in the evening to even up to like 9 degrees centigrade. But in the afternoon, it can be really hot. And so because of the fluctuation in the temperatures, some people still use air conditioning during those really hot periods. And so that is one of the reasons why I mentioned that at the beginning of this live, that you need to make sure that all your air conditions have been washed thoroughly. The filters have been removed or changed, or removed, changed, or washed, so that you don't come down with some of those allergic skin conditions or even some infections. Some infections have been known to be transmitted through the air conditions because of the poor filters, because of the very dirty filters, or the filters that haven't been taken care of adequately or even changed in a long time. So if you feel you must use air conditions, maybe just use it for a brief period, maybe like about 10 to 15 minutes to cool the temperatures around you, because anyway, the temperatures will fluctuate. So don't use, if you can, reduce the use of your air conditioning, because that air condition can dry out your skin to the point where that skin can crack. And so that natural look of your skin will not be maintained. All right. And you may need to frequently top up your moisturizing creams during the Harmattan season. Some of us, especially females, carry around not only our lip balm in our bags, but also some form of a hand cream or some moisturizing cream in a small bottle, which is a handy, pocket-friendly bottle, or a handbag-friendly, bottle, where we can frequently moisturize our hands, moisturize our arms, our forearms, our feet, the soles of our feet. And many of us, during the Harmattan season, many of us perform ablution. This is a Muslim ritual that is carried out frequently during the day, just before the prayers. And this involves using water to wash our faces, wash our hands, wash our feet. And so it is a good idea for us to carry around body creams or hand creams available nearby Very handy so that we can frequently reapply them during the day, during this weather. Please don't forget to close your windows and your doors. I found out that over the past few days, I don't even need to open my windows when I'm sleeping at night because the temperatures are so cool that the little wind, or should I say the little wind that is coming in through just a small part of the window that has been opened is enough to sustain the air circulating around your room. Because if you fling open your windows and your doors wide open when you're sleeping at night, you'll find out that in the morning when you come to look at your floors, or as you're dusting your bed linen, you find out that there's a lot of dust there, which means you've been inhaling a lot of dust into your system. So you don't need to open your doors and your windows during the Harmattan season. You can open it a bit, just slightly a bit, and I think that is okay for you. Make sure that you clean all your surfaces frequently in your house, the tops of your tables, the tops of your chairs, the furniture in your parlor, the furniture in your dining room. Keep them clean always. Frequently clean all your surfaces with moist cloths. Dust everywhere appropriately every day, if possible, even twice a day. And you'll find that you are going to have a lower incidence of illnesses, allergic conditions, inflammatory conditions during the Harmattan season. Make sure that you uh, one of the things that I'm going to mention, or should I say, I'm going to have a live on during the course of this Harmattan season is I'm going to talk about fire incidences during the Harmattan season and how to prevent them in another live. I hope you'll join me for that. So one of the things that is advocated during the Harmattan season, as the Harmattan season is approaching, is to make sure that you have all your smoke alarms working, they're functioning adequately, and also make sure that you have your fire extinguishers that are up to date, labeled, and you know how to use them. You've taught your family how to use them, because we do know that fire incidences are much higher during the Harmattan season. As I mentioned before, we're going to talk about that in another live. And don't forget that, as I mentioned at the beginning, this Harmattan season results in poor visibility. So driving, when you're driving your cars, make sure that if you need to wear your eyeglasses when you're driving, you wear your eyeglasses. If there's poor visibility and you don't have to go out, you don't need to go out. No need to drive. All right. If you need to travel, well, yeah, I mean, you may or may not need to go to the airport. You may need to go to the airport, should I say. However, just be prepared for those flight cancellations because of the poor visibility. And so, um, uh, yes, please take your shots. Make sure that you educate all your family members about the risks of the Harmattan season, tips and tricks I mentioned on how to prevent yourself from getting ill this season, how to stay healthy during the Harmattan season. And again, I would like to invite you to subscribe to the Medical Information channel for more health advice. Click on the pinned comment in the comment section where should I say, I have a free resource for you. It's called the Don't Get Sick Checklist. And it is imperative for you during this Harmattan season that you don't get sick. So click on that link in the pinned comment below for your Don't Get Sick checklist. And guess what? You can buy us a coffee. You can buy me a coffee. You can help support this channel. Still check for the link in the pinned comment below. And I remain Dr. Hadiza Marliyya Suleiman, your favorite holistic reconstructive surgeon, signing out today on the first live. Hope you enjoyed it. Love you and bye.